Hello, everyone. I'm Patricia Davidson, Vice-Chancellor and President of the University of Wollongong in Australia. It's my great pleasure today to speak to you on the Sustainable Development Goals and the role of nursing research in this process. So what I want to do over the next 20 minutes or so is outline the importance of the Sustainable Development Goals and their impact on the health and well-being of communities. Discuss the social, political, and economic factors influencing healthcare, and emphasize the importance of power and nursing in policy, practice, education, and research. So here, as you will see, are the 17 Sustainable Development Goals, with many goals and targets sitting under these. Often we think about SDG 3 as focusing on good health. But we know, in particular from nursing, unless we have clean water, unless we have safe environments, unless we have environments where people are not living in trauma, we cannot have effective and efficient healthcare. But for us, and particularly who have been trained in nursing, often in a narrow biomedical model, we have to broaden our thoughts and horizons as we think to what the future may look like. And I hope during this presentation, I will stimulate you to think a little bit differently about how we approach healthcare. I'm going to use two exemplars from the Sustainable Development Goals. The first one I'm going to talk to you is climate action. All around the world, we know we need to act quickly in order to address the trauma that our planet is experiencing. We know whether you live in a rural village or a big city, climate change threatens your health. And factors such as food insecurity, air pollution, and water pollution affect health. And we know that climate change is expected to cause an additional 250,000 deaths a year due to malaria, malnutrition, diarrhea, and heat stress. And we've all seen the profound impact of COVID-19 on our world. This report from the Lancet Rockefeller Foundation signals that we are in the Anthropocene era. That is, for the first time in human history, where our life on this planet is substantially doing damage. It's an urgent call to act. It's an urgent call to move forward in order to have a healthier world and a safer planet. And increasingly, we are looking at the health from an ecological model. And we now talk about planetary health, which is a solutions-oriented transdisciplinary field and social movement that focuses on addressing the impact of human disruption on the Earth's natural systems and life on Earth. And more importantly, this addresses not just human health, but animal health as well. And as I mentioned, now perhaps climate change is one of the greatest global health threats of our time. We have seen around the world the displacement of populations and acute trauma that is being caused from increasing natural disasters. And we know that all around the world that climate change is having an disproportionate burden on those who are underserved and marginalized. Now, here we can see that climate change has an impact on human health. Severe weather causes injuries and fatalities. We know that where there is geopolitical trauma, there is forced migration and civil conflict. And we know when there's an impact on water and food supplies, we have malnutrition, diarrhea, and also other infectious diseases. So climate change has a direct impact on human health. And as we as nurses think about our innovation and our research beyond the traditional confines of the hospital, we also have to think about different data sources, different methods, and different forms of collaboration in order to address complex and problems that our patients experience. And here we can see with this slide, we can see that there has been a deforestation. And this was not just due to climate change, but because people wanting to, in particular, guerrilla warfare, where people do not want places for people to hide. But as you can see, taking away trees and foliage leads to arid, drought, and areas where there is not sufficient food for people. So as we think about nursing research, I think we have to think about health with care within an ecosystem as well. We have to think about what are the social, political, and economic factors that influence healthcare. We have to think of what happens at organizational levels. And we also have to think about what happens at the level of the individual. And as you can see, it's the intersection of each of these factors which has a real impact on health and well-being. And here, when we think about climate change, we have to think about it from each of these perspectives. We have to think about what is the impact of social determinants of health, how our social, political, and economic systems drive climate change. Moves to decarbonize are very politically motivated, but these are things that we have to consider in terms of human health. We know that all around the world that many nurses are engaged in many aspects, particularly in global health. And we've seen much innovation, particularly in the management of HIV and family planning. Many innovation strategies have come from trying to address the Sustainable Development Goals. And thinking about these from an integrated, coordinated perspective is very important. The other thing that I really wanted to also emphasize is the importance of translating our evidence into practice. This is a study here on the left-hand side, published in The Lancet, where it was showed that nurse-to-patient ratios improved the outcomes of individuals. But my editorial here with Professor Ullman on the right-hand side shows that often these research studies are ignored because we don't necessarily value the nurse. And although this study is done in the acute hospital system, often even in the community where we're trying to tackle the social determinants of health and address sustainable development goals, not always is the value proposition of the nurse truly valued. What are our knowledge, skills, and competencies that we are bringing to address these very complex issues in our society? And so now I'm going to talk to you about gender equality, which is another important sustainable development goal. And why is this important? Because despite significant advancements around the world, unequal power relationships exist between men and women. Where there are in many societies social norms that decrease access to education and paid employment for women. In spite of the aging of the population and increased chronicity of disease, there is still a focus on women's reproductive roles. There is a failure to recognise a life course approach to health and well-being, and that often a child's life course is set on the basis of the postcode or the area in which they are born. We know too that many women are at increased risk of physical, sexual, and emotional violence. And we know that women are often poorer, and often in old age, women are the poorest group in society because they have not had adequate superannuation across their life, and often, particularly in the case of marriage disruption, they are left with inadequate resources. So as you can see here, gender equality, which is Sustainable Development Goal number 5, should be an important focus of health and well-being for nurses. And why does this make a difference? We know that healthier women and their children contribute to a more productive and educated society. We know that the economic performance of many societies depends upon the health of women. And we know that access to education contributes to long-term productivity, not just for women, but society. And if we look at this whole range of economic indicators, including gross domestic product, income per capita, gender equality is an important driver of these factors. So as you can see, it's really important that as nurses, we address social determinants of health. And this needs to happen in communities, not necessarily in the hospitals in which we work. But as we tackle this in our research, I think it's really important that we differentiate between sex and gender-based differences. Basically, sex refers to biological factors, including our genetic makeup and our anatomy, whereas gender refers to our culturally defined roles and responsibilities and the attributes that one has to, and norms one is often compelled to adhere within society. So also as we look at doing research, particularly to address the Sustainable Development Goal of gender equality, we have to think about the competing meanings of gender. You know, sometimes people use female or as a substitute for sex. Often gender is seen as an identity. And then more importantly, particularly in research, we have to think about gender as a social system. What are the norms that allow women to be active participants in society, both within the family and the institutions in which we work? And we know that gender creates social stratification and varying access to resources, power, and roles, and it influences our behaviours. And we know in society there is significant gender inequity, that there is a pay gap between men and women, that without decisive action will take nearly 100 years to achieve equal pay. We know in households, women do over twice the amount of unpaid care. And we know what is very important, that women still have minimum representation in Parliament. And having voices of women at decision-making tables is critically important. The other thing that I just also wanted to talk to you about, particularly as we look at social determinants of health, is thinking about adverse events across the life course. And as I mentioned, often it's the situations in which people are born that determine their destiny and longevity and health over life. And then the other thing that we need to think about is intersectionality. And this refers to the intersection of race, gender, health, and other characteristics that interface to determine identity. And more importantly, when we look at nursing research, we have to focus on the social determinants of health. That is the non-medical factors that influence health outcomes. So basically the conditions in which people are born, live, grow, and age, and also die. And these factors are really driven by social, political, and economic factors. And we won't achieve the Sustainable Development Goals unless we address each of those. So while it can seem daunting, this to me as a nurse is very exciting, because if we look at health and well-being, although there's a lot of focus on genetics and genomics, we know that up to 60% of people's health and well-being can be influenced by the social determinants of health. But we cannot change our parents, but we can change the circumstances in which people live and increase their opportunities. So increasingly, it doesn't matter what area that you're working in, poverty, access to care, environmental exposure, and racism all contribute to adverse health outcomes. And if we want to look at equity, we have to think about tailored and targeted solutions. So here is disparity. often people talk about equality. That means giving the same thing, doing the same intervention to everyone. But we know for some people, they are going to need additional support to move forward. So emerging from the pandemic, I think there are some critical lessons to learn in terms of nursing research and how we move forward. We cannot think about interventions in isolations. We have to think about them within a system. And here on this slide are the 6 pillars of the building blocks of a robust health system. And as you can see, if you remove one of these factors, it's very challenging to achieve good, effective healthcare. And more, the pillar number 6, which is the healthcare workforce, is going to need increased attention so that we make sure there is adequate numbers of nurses to provide care for the future. Here in this slide shows the influence of social determinants of health and the impact on COVID-19. As you can see here, socioeconomic status, access to care, comorbid conditions, discrimination, unemployment, all of these factors all contribute to adverse outcomes. But what is exciting is if we expand access to housing, we provide food, adequate food, if we increase access to the internet, partner with community members, all of these things can improve health outcomes. And these are some of the things that we should be thinking about in health interventions. I just wanted to share an example of how someone has truly operationalized the Sustainable Development Goals. And this is my colleague, Dr. Nancy Glass from Johns Hopkins University. Her area of research is intimate partner violence and decreasing violence against women. And through innovative research, she has combined the study of intimate partner violence and what is going to make women safer and secure through implementing 2 really innovative interventions. One is called Pigs for Peace and one is called Rabbits for Resilience. And here you can see the children with the rabbits. But basically, this is an intervention which tackles intimate partner violence through economic empowerment. I really encourage you to Google some of her research papers. This is innovation to address the Sustainable Development Goals, targeting gender equity, targeting economic empowerment, and addressing gender equity. So what will it take moving forward? I think where COVID-19 has catapulted us into a new paradigm. We need to think about nursing research from a societal perspective, where we think of the intersection of macro, meso, and micro factors. So what will this take for nursing to move beyond the confines of the hospital to address social determinants of health and the Sustainable Development Goals? Well, I think we need adequate training, we need more resources and mentoring. We need access to funding and support. These large-scale studies that tackle environmental, cultural factors need adequate funding. We need to think about methodological innovation. How do we deal with large data sets? How do we deal with innovative methods for identifying person-centered preferences? We also need a political will and engagement. But more importantly, we need a belief in the power of nursing and science. And I know that's a value that you share with me. And so I really hope that just my short time with you has not just emphasized the importance of considering the Sustainable Development Goals, but identified how nurses and also midwives can be part of this solution. Now, this will require political awareness. It will require innovative methods and research methods. And it'll also require us thinking about what are the narrow biomedical confines that many of us were taught about in nursing school and have operated on in a very long time. COVID-19 has recognized that the pandemic will not be cured or tackled within the confines of the hospital. adequate control of COVID-19 has meant meaningful engagement with communities. I think each of us have learned a lot during this time, and I think we need to carry those lessons forward in order to make sure that we meet the challenges of the future and meaningfully address the Sustainable Development Goals. Thank you so much for your attention. I wish I could be with you in Japan, and if any of you are coming to Australia, please come and visit me at the University of Wollongong. Thank you.